Thanks for joining us for Capital City News. We hope you're taking care and staying healthy. A lot has happened in the last couple weeks. To start off, we've been experiencing aftershocks since the March 18th earthquake. Know that this is normal and that this can last up to months, even years. In addition to that, we're also dealing with the coronavirus pandemic, which is affecting our daily lives. Know that if you're staying safe at home, that you're doing your part. We know this time isn't easy, but we hope that you can keep at it, stay safe, and stay strong, Utah. On this week's episode of Capital City News, we hear from Salt Lake City Mayor Erin Mendenhall on COVID-19 updates. Let's get started with our legislative update.
At its April 14th meeting, the City Council and Redevelopment Agency unanimously approved a loan amendment for the Housing Assistance Management Enterprise to cover a new mixed-use development on State Street, approved an extension of the mayor's March 18th emergency declaration for the earthquake in order to preserve FEMA funds, and received an update about the mayor's most recent emergency proclamations. To learn more, visit slc.gov/council.
On April 15th, Salt Lake City hosted its first COVID-19 Ask Me Anything session with Salt Lake City Mayor Erin Mendenhall and City Department directors. Here are some highlights for Mayor Mendenhall.
What it boils down to is science and public health. This is about data. This is about a virus that is highly contagious and that is taking the lives of our community members. So I know as a family, as a neighbor, as a community member, as a mayor, that we're getting restless and that our whole household's getting restless, and spring is springing, and we've been out of school a long time, and people want to get back to work. People need to get back to work. That businesses want to reopen. Business want their clientele to increase again. We all feel that, and this is a hard time. This is literally about saving the lives of our community members. That is why we're doing this. And the actions that we have taken and that we led on as a county are working. And we see that in the Utah data that we have. Know that on a day-to-day basis, we're working with the public health department and looking at the data that's coming out, local data that's helping us guide these decisions. And it is a dial, it's not a light switch. We're not going to see a scenario where we say everything's open again and all social distancing measures are removed. We're going to be looking at that data, which is detailed, and I'm not a statistician, so we're grateful for the experts with the public health department who are helping us make those policy decisions based on the data, but partially it's about the rate of spread. And we know from data released on Friday afternoon from the county health department that Salt Lake City is the hardest hit in the county, and that certain zip codes in our city in particular are being the hardest hit. So I think we're a ways away from that dial starting to crank back open again. But we are going to be making decisions from a data-based and public health perspective, and then doing everything we can to support our people and our economy as we go through this. We want to hear from you. Anyone in the public, reach out to us as a city. You can go to the mayor's office website. There's a bunch of ways to contact us. Let us know, where can we help fill gaps? Where can we amplify? What do you see that we aren't seeing? We need to hear from you. We want to help. We are acting in the most dynamic and compassionate way we know how to as a city. We love you and we want to help take care of this, and we want us to recover as fast as possible.
We understand that if you're not sick, getting out and getting fresh air is important. But please remember to do your part to help slow the spread of COVID-19. Right now, the CDC recommends wearing face cloths or masks to help protect not only you, but others around you. Please also keep in mind to keep a 6 feet physical distance between you and others that you're not quarantining with, and also resist the urge to gather in groups of 10 or more. And last, if you feel your safety and your community's safety is in jeopardy, you can reach out to the city's Stay Safe line and report it. To learn more, visit the URL on our screen. And last, if you have symptoms, get tested. Call 1-800-546-7707. Next up, we have a series of public service announcements to help us stay safe and healthy during COVID-19.
If you're sick, don't go to work, stay home. If you're an employer, make sure you're giving your employees the time off they need if they're sick, and please don't require a doctor's note. Stay safe out there, stay home, and flatten the curve. In order to protect against the coronavirus, 70 of our city's most heavily trafficked crosswalks will now come on automatically, meaning you don't need to press the buttons. You'll find signs like this going up throughout the downtown and east central neighborhoods to help you know when you're at an automatic crosswalk.
If you're looking for ways to help during this COVID-19 pandemic, Salt Lake City is now accepting mass donations. There are 14 drop-off locations at fire stations across the city. The city will collect, sort, wash, and distribute masks to first responders, essential employees, and vulnerable populations. To learn more, visit the URL on this screen. That's it for another episode of Capital City News. Stay connected on COVID updates and resources by following us on youtube.com/SLCTV Media, or you can follow us on social media at SLCGov on Facebook, Twitter, Instagram, and Nextdoor. That's it for this episode. We hope you join us next time to stay up to date. For SLC TV, I'm Poonam Kumar. Stay safe, stay healthy, Salt Lake City.